Please welcome Chairman of Cleveland Clinic Neurological Institute, Dr. Andre Machado.
I think many of you don't know me yet, so I'll start by telling you a little bit about myself. I am originally from Brazil. The accent is from Brazil. And I'll tell you that I came to Cleveland Clinic to spend only 1 year. And that's what I told my wife. It's what I actually had promised my wife. And now that I am here 15 years later, I can share with all of you that now you know that I have lied to my wife. But I'm very happy here. And I knew the day that I walked through these doors on February 15 of 2004, that if given the chance, that I would stay for the rest of my life. True story, including the part about lying to my wife. I would like to talk to you today about neurological care and about neurological care here at Cleveland Clinic. And why is it that we need to talk about neurological care? Neurological disorders affect our families, affects mine, affect our communities, our friends. And as the population continues to age, it will affect 1 in 10 Americans, and 1 in 3 seniors will die a very forgetful death as a result of a degenerative disorder. That's neurological care. What is different about what we do here at the Cleveland Clinic? All of us know that everything we do is always around the patient, everything we do. It doesn't matter if we are seeing the patient in the clinic, doing surgery in the operating room. It doesn't matter if we're doing research in the laboratory. We all know how to converge around the care of the patient in front of us today and the patient of tomorrow. We know that many of the disorders that we treat really have no cure. Alzheimer's disease, Parkinson's disease, stroke. But we're not complacent about it. We want to change this reality, and I think we can. And we have already made significant strides to changing this reality. We are world-renowned to be the best place to be treated for multiple sclerosis, to have spine surgery, for treatment of epilepsy. We are pioneers in the use of deep brain stimulation, brain pacemakers, to treat people with Parkinson's disease, and now to help them recover from a stroke when it paralyzed one side of the body. We're also pioneers in brain mapping, using multiple technologies, invasive and non-invasive, bring them all together to study the brain of one person to pinpoint a disease in that one brain so that we can treat the seizure or the brain tumor without damaging the tissue around it. 300 physicians and scientists, hundreds of caregivers are absolutely passionate about this, about brain care, about neurological care. And they want to do better, they want to do more. One of our major limitations, Dr. Mihailovich just told you about, is that we're working out of the oldest facility of the Cleveland Clinic, the original building of the Cleveland Clinic. It's almost 100 years old. And this is an opportunity for me to tell you about the new Neurological Institute. It is going to stand right in the middle of our campus. And this is not just a beautiful building that will be pleasant to work and pleasant for our patients to come to. This building is going to be designed to change how we do neurological care. And how is this change going to happen? It's going to happen by means of digitization, distance health, and discovery, 3 Ds. And I'll tell you quickly about what they are. What's this big word, digitization? It is our ability to incorporate new technologies that will replace the naked eye of the neurologist, will replace the old hammer that you have all seen, put that behind glass and use new technologies to learn about the symptoms of our patients with accelerometers, gyroscopes, digital plates that we can walk on and sense our gait, and virtual reality to understand how a person sees, comprehends the environment, and thinks. And then if we repeat these measures over time, we can, of course, learn how a person is doing with that neurological problem and catch symptoms before the patient is aware so that we can provide earlier treatment. What about distance health? Distance health is when we take digitization to your home. It's when we use a digital tomographer and the digital presence of our neurologist in the screen of an ambulance, a philanthropic gift, to see the patient and make a decision on whether to use a life-saving drug or not in the patient's driveway, taking away all that wasted time of going from home to the hospital, waiting in the emergency department, getting a neurologist to come see you, and then make a decision. This is transformation, digitization, delivered to the door, to your footsteps. And distance health is also about seeing patients by virtual visits. We do now hundreds of these every month. You see here Dr. Fernandez seeing one of our neurological patients from home or from the workplace. What about discovery? What this new building is going to enable us to do is to recruit the best talent, to make this the nervous system of the Neurological Institute, recruit the best minds so that physicians and scientists can work side by side to learn more about neurological problems, figure them out, come up with new treatments, and one day come up with a cure to the neurological disorders that we need to. I'm here today really with an ask. I have a clear ask for you. I want your support. I need your help to help us continue to be the center, the Neurological Institute, that always provides the best care that's possible today for our patients, while simultaneously developing the neurological care of tomorrow. I want to thank you for the gifts you have given us, and thank you in advance for the gifts that you will give us in the future. And with that, I would like to invite Dr. Mihailovic back to the podium.